Was there anything that surprised you about the results of the study you presented at ACC 20?
Um, the thing that was surprising was that the prevalence of burnout has increased over the last several years. So despite no major shifts in healthcare at the time of the survey, um, the the prevalence has increased, and that was concerning. Now, one of the things to remember that the numbers were done pre-COVID era, so I expect it to be even more alarming at this time.
What do the results indicate about various risk factors for burnout? What does it say about age, practice type, and certain subspecialties that may or may not be more at risk than others?
Sure. So our survey didn't show a difference in terms of subspecialty. What we did notice was that the prevalence of burnout is higher in women compared to men. And that may be indicative of work-life balance issues and career versus home demands. We also saw higher rates of burnout in the mid-career cardiologists compared to the early career and late career cardiologists. If we had to speculate, that maybe because, perhaps late career cardiologists see the light at the end of the tunnel where they're going to get to retire and enjoy life some. The early career cardiologist, we often think of as being busy, trying to get their feet wet, learning their practice, and starting a family. However, it's the mid-career that had the higher prevalence, and we may speculate that to be because mid-career cardiologists are in a unique category. They trained at a time when on paper and then dictating and then went over to electronic health records. And so that's a bigger transformation versus the early career that over the last 7 years, they've kind of grown up in the field of electronic health records. So they know nothing else but that. Additionally, we can speculate that it might be also practice settings. Um, the mid-career cardiologist is aware of more private practice models, more physician-owned practices, and the physician being the ultimate leader of practices and making the decisions and having the autonomy and control over their practices. And that has changed over the last decade or so. For the most part across the country, I'm sure there are places that still have the autonomy in private practice, but for the most part, most cardiologists are now employees. And the early career cardiologists, they have grown up in that environment, so they don't know the difference either in terms of what it's like necessarily. And so they are more adaptable to the present than those of us who were used to a different way of practicing medicine.
All right, yeah, it's definitely a changing landscape in cardiology for sure, especially in recent years. And now I know you touched on in your presentation that you're concerned about how this impacts on women and especially mid-career women in cardiology, how this might disrupt the pipeline. Oftentimes, because burnout can be pretty jarring when we look at the short-term impact. People forget the long-term impact of burnout and what we might see because of the burnout now in 10, 15, 20 years. Can you touch on the impact of the impact on the pipeline of women in cardiology and some of the other potential long-term implications if this continues to go unchecked?
Yeah, I mean, if cardiologists continue to be burned out, I think cardiology would seem less likely a desirable field. And I would say that in medicine in general itself, but certainly in cardiology, we're attuned to the fact that our pipeline of having female cardiologists is already not so great. And so that would be problematic. And I think that when physicians are burnt out, they tend to be more callous and they don't make it seem like a highly invigorating field. And so that will affect our future pipeline, both for female cardiologists, but also for just the general potential cardiology fellow. I think that it's not only the pipeline of getting more trainees, but it's also the culture that we create for our staff too. And so it can have negative implications on, who are advanced practitioners and how wants to be working with us, as well as the culture that they exude on themselves. And there is some data that, in terms of our data that we presented, that about 9% of cardiologists reported saying that they may have made a major medical error in the prior 3 months, of which almost 60% of those who said yes were burnt out. And so that would be a concern. Granted, these are perceived errors and no documentation of true errors, but that would be a concern as well.
Yeah, there's definitely some pretty concerning real world implications behind the impact of burnout. And now, just briefly, I want to touch on how do you think burnout might eventually impact younger and future cardiologists? I think you touched a little bit on how people sort of view cardiology could be impacted by the levels of burnout. Young cardiologists are an eager and often very competitive group. How do you sort of embrace this while still being cognizant of the impact that burnout can have?
Yeah, I mean, we want to encourage the young cardiologists to come join the field, and granted, cardiology is a competitive field to get into, and we're competitive within the field, and I think that competition has helped advance the field as well. I mean, we've done great jobs in terms of advancing the science within cardiology, and that vigor and interest has been there and will always remain there as long as we continue to be somewhat competitive. But at the same time, I think that we need to make sure we take breaks for ourselves. One of the things that the younger cardiologists are more adept at, regardless of gender, is the desire for work-life balance, and so they kind of balance us old timers in terms of insisting for that work-life balance, which many of us are used to work, work, work. So I think that the younger generation having that perspective are going to invigorate more to come into the field. Many people that are within the field of cardiology also have some connection to it, a personal connection in terms of a family member that may have suffered from cardiovascular disease. And we know cardiovascular disease is the #1 killer of men and women. So we do have that edge in terms of getting people interested in the field at a young age when they've had family members that have suffered from it and they want to make a change. But yes, you're absolutely correct. We are very competitive, and sometimes we need to stop, pause, and breathe.